Hi, I'm Akila Roller, a Miles Community College nursing student. Today I'm going to show you how to do an IV. So you're going to start off with your 6 rights. So your right patient, right medication, right dose, right route, right time, and right documentation. And then you're going to do your hand hygiene. So then you're going to look, and you look at your physician orders and your MAR. You'll compare them and make sure you have the right. So you're looking, and you have an admit for rehydration antibiotic therapy. So you're looking at both of those. So you want to initiate an IV of 0.9 NS 1,000 milliliters to infuse over 6 hours. So to start with, you're going to get your bag of medicine. So you're going to look at it. You're going to look at your bag. You're going to look and see, make sure there's no particulates, make sure it's all good. And then you're going to check your expiration date. And we're good on this one. So you're going to look at all that. You're going to get 2 patient identifiers from your patient, and you're going to explain your procedure. Have them in a comfortable position so that you can do the IV. Then you are going to open this up. This, and you are going to want to label your IV medication. So for this, I'll use tape because I don't have an actual sticker. And you will label it with your infusion rate, initials, and the time. Okay, you'll have this labeled. I'm going to make sure. So, you have this done. Then you're going to need your continuous flow. So, open up this. Maybe. This is your continued flow. So, first thing first, you are going to want to make sure that your roller clamp is closed, or else you're going to have stuff all over the place. So make sure that's closed. Then we're going to take this, and there's this and this end. The 2 ends. Then you want to pop this off, keeping aseptic technique. Take the top of the spike off, make sure you keep it clean. And you want to spike your bag. And then you want to hang your bag. Okay. So, hang your bag. It's not tangled like mine. And you will want to fill your drip chamber about halfway. Can you see? Okay. Okay. Then you want to prime your tubing. You want to get it through every point. And your tubing is primed. So then you have your IV all set up and ready to go. So then you will want to have a linen pad under, and you will get your patient ready to do the IV. So perform hand hygiene, clean up, and then you will so then you'll position your arm the right way. And then you're going to want to apply your tourniquet, and you want it 6 inches away. You You want it away from the vein that you're going to choose. So then you tourniquet your arm, and then you're going to palpate, and you're going to find the vein that rebounds towards you. So you're going to find the vein that bounces, and you want it to rebound. So here, and you want to go as distally as you can. So this is the hand, this is going up the arm. So you find your spot. Okay. If there's any hair there, you don't want to shave it. You're going to cut it with scissors. And then you're going to loosen your tourniquet for now. You have your spot. You're going to go gather all your supplies. So you're going to have your IV, your saline lock, dressing, gauze to put under it. And you will have all of your supplies. Your saline flush. So after you have your supplies, you're going to reapply the tourniquet. And you will have your needle and saline lock ready. Take a alcohol swab, clean, circular motion into the out. Then you're going to have your needle. You want the bevel up. Then you go find that vein. You're going to go in at about a 5 to 30 degree angle. You go in, and then you look for flashback. You have flashback. At that point, you want to only advance the catheter, not the needle. So then, after that, you're going to take this off. The catheter is in and advanced. You're going to be holding up here on the vein like this, releasing your tourniquet, applying your saline lock so that you're not getting blood over, and you're going to have pressure here the entire time you're applying your saline lock. So now your saline lock is in. Then you're going to have tape, and you're going to do the chevron. So you're going to come under, and you're going to tape across, and you are going to tape across. And then that is now in place, and you have your transparent catheter dressing. So you have this, and you will want to label this with the date, your initials, and the gauge of your needle. Then you'll take this, and you're going to put it, you only want to put this over the catheter part, not the saline lock. So you put this on, and you are set to go with that. Then, for more comfort, you're going to have this under the saline lock. You're going to have a piece of gauze. It'll be smaller than this. This is all that I had. And you will have it secured down onto there, so that it is more comfortable on the patient. So then you have this, your saline lock's in, you're ready to go. And you're going to have to look at your physician order and your MAR again. So you want to look, so you need to initiate the IV 0.9 normal saline, 100 or 1,000 milliliters to infuse over 6 hours. So you're going to have to calculate out your drop factor, which is 10, your milliliters per hour, which is 167, and then your drops per minute, which will calculate out to 28. So after you have that calculated out and you have your infusion rate, you are going to unhook this, and you will insert this onto your saline lock, and you have to put enough little pressure to get it on. Okay, and that is on. So then you're going to have to come and you look here, and you're going to have to calculate your drops per minute. So you have to watch how many drops, and it needs to be 28 drops per minute. calculate your drops. Okay, and then you have your 28 drops per minute. And you leave that at that, and that'll infuse for 6 hours, and you are set. So then you dispose of all your stuff. Make sure your patient is in a comfortable position. While this is infusing, they can lay their hand or their arm so it's comfortable. Then you're going to go back and you're going to document what you did. So you're going to go back and document the infusion rate, where you put the IV, how the IV went, is there any infiltration, is there any redness or swelling or anything else. So you're going to inspect that. You'll make sure you want to document that you have the correct solution that you're infusing into the patient. And you will inspect for your patency and just make sure it's all good. And then you will leave your patient to be.